Welcome to the 2022 graduation ceremony of New York University's School of Global Public Health. Please rise for our special guests, administration, and faculty. Let's have a round of applause for our graduates. Now, please welcome Dr. Cheryl Healton, Dean of the School of Global Public Health.
Good afternoon. On behalf of the faculty, staff, and advisory board of the School of Global Public Health, welcome to the beautiful United Palace Theater. Before the festivities begin, I'd like to first thank you for your voluntary masking today in response to the CDC guidelines, New York City Department of Health guidelines, and at the request of the United Palace Theater. As a School of Global Public Health, your health and safety are of paramount concern to us, so we strongly encourage you to mask for the duration of this ceremony for your good health and for those around you and those with whom you may later be in contact. I'd also like to take a moment to recognize the lives lost in Buffalo, New York this past weekend. Horrific mass shootings and several others the past year underscore one more public health crisis we must work together to solve. Our alumni and our students today are working to make the world a better and safer place by combating inequality, white supremacists, racism, and ethnic divides that cause ill health, cut lives short, and undermine the peace we sorely need in our world right now. We are proud that your contributions will help light the way for this safer and more peaceful future. It is with great pride and excitement that we host our first in-person graduation ceremony since the start of the global pandemic in 2020. It is wonderful to see you all here in person and to celebrate the graduating class of 2022. And what a remarkably resilient class it is. This year's extraordinary group of students is our largest yet, making the important step in their lives to enter the field of public health and to do so when the nation and indeed the world needs them most. They have maneuvered through their coursework under extremely trying times. The capacity to be flexible and to persevere under such circumstances are hard-earned skills that they will now take into their workforce professional lives here in the US and around the globe. Over the arc of my own career, I too have weathered several epidemics and pandemics. The learning curve is steep, but will put you in perspective for you what lies ahead on your path in public health. Consider it one of your superpowers and please use it wisely. The other superpower is your heart. It is the muscle, most of all, that can change this world for the better. Use it and use it well. Without further ado, it is now my distinct honor to introduce the co-chair of our Dean's Council, Jeffrey Gould. Jeff is president and CEO of Portable Inc., an amazingly innovative company that upcycles shipping containers into housing, medical facilities, and storage units. Among the many leadership roles he plays here at NYU, Jeff serves as on both the NYU Board of Trustees and as the Alumni Association Board of Directors member. Please join me in a warm GPH welcome to Jeff Gould.
You did it. Let me hear. Come on. On behalf of our chairman, Bill Berkeley, and the Board of Trustees, our president of the Alumni Association, Dasha Ratu, you now join 600,000 plus NYU alumni. We're a global family. We're a global family. And what Dean Hilton has done here with your new alma mater has paved the way. Your new dean coming in, Dean Fur Holden, will continue that path. Dean Holden, could you just wave for me? We want to hear from you. We want to know what you're doing as alumni to make this world a better place. And remember, those that have come before you have paved the way for you to be here, and you now pave the way for those that come after you. Congratulations, class of 2022.
Thank you so much, Jeff. It is now my privilege to introduce NYU's 16th president, Andrew Hamilton, who was on hand with our provost, Catherine Fleming, just a few weeks ago when we cut the ceremonial ribbon at our new building at 708 Broadway. President Hamilton has been a champion of our school, and we're thrilled to have him join us today. Without his unwavering support, there would be no School of Public Health at NYU. His leadership during the COVID crisis has been nothing short of extraordinary and inspirational. Please join me in a huge welcome for President Hamilton.
Dean Hilton, thank you very much for that warm welcome. Ladies and gentlemen, what an absolute delight it is to be here with all of you celebrating the amazing GPH class of 2022. Congratulations. Now, after 2.5 years of COVID-induced restrictions, it's just wonderful for my wife Jenny, who's in the audience, and me to join all of you in this very, very special event. And what a place to hold a graduation, the United Palace. It is magnificent. I don't know about all of you, but being in this setting makes me want to channel my inner Beyoncé and show off my threads. Because for all of you, you are magnificently dressed in NYU Violent. We are here in style, and we are here in person. Isn't that wonderful after 2.5 years? And the class of 2022, you are a remarkable class. This is a remarkable school, the School of Global Public Health, and what a year you've had. You, the School of Global Public Health, are enjoying record applications and record enrollment. You've reached the top tier of US schools of public health in record time, and you are climbing the rankings higher and higher each year. Your research endeavors as a school are growing exponentially, and you've founded many important and critical major initiatives in areas such as global mental health, environmental justice, anti-racism, and disaster science. And as you heard from Dean Hilton, you have moved into a truly magnificent, a stunning new home at 708 Broadway that gives this palace a run for its money. And welcome to that new school for all of you. These are only just brief highlights of a truly impressive trajectory for the school in the span of only a decade. For that, everyone in this room, in the audience, among the graduates on the stage, every one of us knows that we owe a deep debt of gratitude to Global Public Health's founding dean, Cheryl Hilton. Cheryl has been a champion, an energetic cheerleader of global public health from the very beginning, and she took it from a newly formed institute to what is now a world-class school of public health. Dean Hilton, we thank you, we appreciate and recognize your many, many contributions to this school. Thank you, Cheryl. And another sign of the school's health and its ascent is whom it is able to attract to its ranks, students, faculty, and soon a new Dean of Global Public Health. And let me also welcome Deborah Furr-Holden, Cheryl's successor, who will join us in July. Deborah. And let me introduce her. She is a renowned epidemiologist, currently at Michigan State University. She's an accomplished public health professional with expertise in a wide range of areas, but most importantly, including health disparities and prevention science. But today, class of 2022, this day is about you. And you have so much to be proud of. You are graduating from one of the premier schools of public health in the country. You have achieved your goals despite studying and earning your degree at a time of immense upheaval in the world and in New York City. You have the knowledge and the skills to make a difference in a field that is urgently important. Dedicating yourselves to a calling in which you will be extending and saving lives takes tremendous heart, tremendous dedication, and all of us applaud your commitment to society, your commitment to public health. But each one of you has made the NYU community better by being part of it, by bringing your skills, your contributions to it. So let me give you a charge today, GPH graduates of 2022. Let me give you a charge today. Wherever your path takes you, wherever life unfolds in the coming years, whichever community you decide to join after commencement, make it better. Find ways small and big to make it more welcoming, more just, more healthy, and more engaged. If you do that, your impact as NYU GPH alumni, your impact will be unstoppable. Class of 2022, these are a special few days you have ahead of you. Today's ceremony, and then on Wednesday, it's on to Yankee Stadium, and the sun will be shining, and someone very special will be getting a degree at Yankee Stadium on Wednesday. I wonder who that is. Who could it be? No. It is not Taylor Swift. She is pretty impressive, but the person very special getting a degree on Wednesday will be you. Every one of you. Because what you have achieved is quite remarkable, and that you have achieved it during this most difficult period says so much about each and every one of you. So GPH class of 2022, on behalf of everyone at NYU, my warmest congratulations to you all and our very, very best wishes for the future. Well done, everyone. Thank you. Thank you. There we are. I got so excited about all of you, I forgot I had another very important person to introduce. And ladies and gentlemen, it's now my very great pleasure to introduce our keynote speaker, Dr. Mary Bassett, Commissioner of Health for the State of New York. Yes, thank you. Every one of us in this room, every one of us in this city, every one of us in this state owes a great debt of gratitude to Dr. Bassett in helping steward us through this incredibly difficult time. Now, Dr. Bassett has served as New York City's top health official from 2014 to 2018. She is a good friend of NYU's, having visited our campus on many occasions over the years. Ladies and gentlemen, would you please give, as your dean said, a very special GPH welcome to Dr. Mary Bassett.
Well, thank you, President Hamilton, for your inspiring words, and Dean Hilton, proud parents, especially you graduates, congratulations. I am truly honored to be with you on your special day, and I want to add to the congratulations the children, aunts and uncles, friends, extended family, partners, and pets. They all deserve a well done too. You deserve credit for supporting today's graduates and getting them through a tougher than usual years of study while also coping with the challenges of a pandemic. So a big congratulations. This is your day. And before I start, I want to add to the words of congratulations to Dean Cheryl Hilton as she steps down as dean in this coming summer. I want to thank you, Cheryl, for your long and to-be-continued career in the field of public health, for steering the establishment of the NYU School of Global Public Health as its founding dean through its accreditation and significant growth. Quite literally, the school has grown under Dean Hilton's direction with the newly refurbished, now emblazoned on all of our memories, 708 Broadway on NYU's Washington Square campus. So thank you again for having me here today. I've known Dr. Hilton for a long time, longer than either one of us may want to remember. And I know that there are many exciting things still to come, so I look forward to your future endeavors. I should explain and confess at the outset that except for high school, I didn't attend any of my own graduations. I can't even remember where I was when I was graduated from college. I was definitely in Tanzania when I was graduated from medical school and had already moved to Zimbabwe when it was time for me to receive my MPH degree. So anyway, the point is that I don't have firsthand experience sitting in your seat and listening to a graduation speech, but I've been warned that these are almost always too long, too boring, typically forgettable, and I'm going to try my best to improve on those expectations, but my sincerest apologies nevertheless. I'm also aware that giving a commencement address is an august responsibility, even though it's likely that you won't remember a single thing that I say a few years from now. I do hope to leave you with at least something to reflect upon. And so I'll be guided by the esteemed Maya Angelou, who said, "I've learned that people will forget what you said. People will forget what you did, but people will never forget how you made them feel." So as is required on these solemn yet happy occasions, I will hope to do my job and leave you with feelings that are celebratory and reflect the promise of and even responsibility for the future that is ahead. I will even try to offer advice, though to be honest, I have rarely taken anyone's myself, so I won't be offended if you ignore mine. I'd like to tell you a little bit about my own journey in public health, how I chose it as a profession, and how I think about its potential today. And along the way, I'll try to inch towards what may pass for words of wisdom. I grew up in New York City, actually not far from here, in Upper Manhattan, in part of Manhattan that downtown people think may be in the Bronx. I'm the daughter of a black father from the state of Virginia, a white mother from the state of New Jersey, and there were other interracial families in our social family circle, and we children were all taught to think of ourselves as simply human. It was the civil rights movement and later the Black Power movement that propelled my siblings and me to identify as black. There was no phrase like biracial in those days. The word was mulatto. This, you may or may not know, is a pejorative term. It's derived from the word mule, which is an infertile animal that is bred from a donkey and a horse, which of course are two different species. But in any case, I digress. My parents, and I want to acknowledge especially my mother, supported my growing understanding that I was a brown girl, a black girl, living in a largely white world. Many of you here today may have come from many different places, different countries, different parts of the United States, and you've had to cope with issues of difference and belonging. And I hope it hasn't taken you too long to figure out that in this global world, we all belong. And I want you to clap for that. We all belong. So, the summer before I went to college, I got a job as a census taker. Back then, the census was done the old-fashioned way. I had a satchel, I had paper forms, and I went door to door in West Harlem, where I had a first-hand look at the different worlds behind the doorways that were just a few blocks from each other. And I'd say that this was my first exposure to public health. The census is really a huge household survey. Sitting there at people's kitchen tables, I had the privilege of seeing into everyday lives. I asked about housing type and tenancy. I asked about assets. I saw inside homes. I even saw the food that was being put out on the table. And this and my own growing up years, we lived in public housing, sparked the beginning of my thinking about the relationship between race, poverty, and poor health. Public health takes you beyond the single person who is the center of a clinical encounter to consider the health of a whole community. I came to public health through medicine, but you can come to it from many different directions: history, social work, psychology, anthropology, city planning, business administration, biology, the list goes on. There is so much social and biological that goes into making us healthy. My favorite definition of public health is this one. Public health is what we as a society do collectively to ensure the conditions in which people can be healthy. I became the first physician in my family, but except for the patients, I have to say I didn't enjoy medical school. I was the only graduating black woman in my class. You can tell from my colors it was not from NYU. But complaining about this when I was a medical student only seemed to make matters worse. One of my advisors suggested that maybe medical school wasn't for me, and needless to say, I ignored that assessment. So I want to pause for a moment and say to any graduates out there who, for whatever reason, felt unsupported or marginalized, that is not okay, but it's over. And you prevailed, you made it, and you now enter the workforce with skills that will make the world a better place. I was fortunate enough to do my clinical training at Harlem Hospital, and that was another decision that I was advised against. A favorite professor of mine in medical school, I did have some favorite professors, told me I should take a much more prestigious residency program, one that I was told that I would likely get. He said, go to Harlem later after you've received excellent training. And I remember talking to Gerald Thompson, who was the chair of medicine and still remains an important mentor to me, and he was urging me to make Harlem my choice. He said, you should come now. And he added, people don't come back. And he said that with some weariness. So I listened to him. I do want to make clear that I have listened to some people, and choosing Harlem was one of the best decisions that I could have made. And it was there that I saw community contexts and how the community contexts that surround us, the social and commercial determinants of health, are so much more culpable for bad health than individual behavior. Many industries, big tobacco, big food, big pharma, alcohol, and others, put people's profit over people's health, put their profits over people's health, and have been left unregulated to unleash lasting harm. And this horrible cost is in lives. During my years at Harlem Hospital, a man in central Harlem was less likely to survive to the age of 65 than a man in Bangladesh, then and probably still now, one of the world's poorest countries. Harlem is a historically black community, and it was in Harlem that I first witnessed firsthand the relationship between racism and health, and the long list of factors that we now call social determinants of health, and how they're all influenced by how a person is classified by race. The neighborhood where you live, the quality of its housing, even the quality of its air, what kind of food is available, the performance of the schools, the availability of public transport, the job market, wage levels, and so on. Basically, all of the building blocks of a decent life in our racially stratified society are seen through the lens of race. And for each of these, black and brown communities are disadvantaged, not because of bad people, but because of bad policies. So as the New York State Health Commissioner, I feel a moral and professional obligation to encourage dialogue and action on issues of racism in health. There are so many statistics that I could reel off to you, but I'll just give you a few. In the US, a black baby is 3 times more likely to die in her first year of life as compared to a white baby. If she survives, she will face a shorter life expectancy, and in New York State, will be more likely, 5 times more likely, to die of pregnancy-related causes. These numbers, written on our bodies across time, reflect only one thing: racism. So long as our public health data continue to show these miserable odds, we will know that the United States has not yet fully addressed the 400-year history that began when the first captured Africans arrived on these shores. So after my training, I spent nearly 20 years on the medical faculty at the University of Zimbabwe. I was there during triumphant years following independence and tragic years as democracy came under threat, and I learned a great deal. Probably the most important thing I learned is how important government is to health, and that explains the position that I now hold. I came back to New York City in 2014. I became the New York City Health Commissioner, and I found when I returned to the United States that the word racism had more or less disappeared from public discourse. There were all these new words. There was diversity and cultural competency, but not racism. So I decided it was my responsibility to talk about racism. And as the commissioner for New York City, I transformed the senior leadership team so it looked more like the people of the city, in which there is no, in our city, in New York City, there's no majority racial ethnic group. I reinvested in our neighborhood district health offices in Harlem, the South Bronx, and Central Brooklyn, and I challenged the leadership to apply a racial equity lens to all of the department's work. So I'm going to make the same challenge to all of you today. Anywhere that you work, you will find that marginalization, where people are deprived of their rights, tracks with poor health. So don't ask, how can I fix these people? Don't do that. Instead, ask yourself, what circumstances led to bad choices and preventable health harms? At the New York City Health Department, I was amazed at the creativity that I saw emerge when I asked that question. And I'm going to share with you one story about the public health engineers. I don't know if we have any engineers in the audience, but affectionately I would describe them as among the nerds of public health. But in any case, I stopped by their offices one day to ask them about cooling towers. They oversee things like X-ray machines, CT scanners, make sure that they're safe, and they look after cooling towers, which are used to typically to air condition large buildings. So as I walk around, I see all these pictures on the walls, photographs of kids smiling in swimming pools. And most of the children are black and brown kids. And I wonder, why are these photographs up here with the people for the cooling towers, X-ray machines, and so on? And it turns out that the public health engineers also investigate swimming pool deaths. And at the time, overwhelmingly, the number of drowning deaths in New York were among black children. The ratio was 8-to-1 compared to white kids. So you might say, well, the parents should have kept their kids out of the pool. Or they should have made sure that their kids knew how to swim. And the city does, and today and back then, offers swimming lessons for free in the city parks in the summer on a first-come, first-served basis. But these engineers decided that they needed to make it easier for children to learn to swim, because first-come, first-served is almost always inequitable. So they developed a whole program. They identified in the summer months unused swimming pools in schools. They got the schools to let them use the pools. They went to the Parks Department, and they got the Parks Department to supply lifeguards and swimming instructors. And then they solicited from a company, a private company, a donation of bathing suits and goggles. They did all that. They took this matter to heart. And as health commissioner, I didn't know a thing about this effort until I walked into their offices and saw the photographs on the wall. They decided this because they realized that it was the circumstances, not the children or the parents, that were the barriers. It was that these kids need to have a better chance to learn to swim. So I want you to plan to put your hands together for the public health engineers. And that's only one example of many that happened when you tell people to think about how to make the circumstances better, how to improve the environment and not just focus on haranguing the people. So when I was preparing these remarks, I was admittedly feeling a bit overwhelmed with all of the bad news. And this was even before the horror of the shootings in Buffalo on Saturday, in which 10 people died at the hands of a white teen. I don't even know whether to call him a man, 18 years old, on the cusp of manhood. So that is not the only horrible news that we face. We face the possible, if not likely, demise of Roe versus Wade. We have the unconscionable loss of life in wars that engulf too many parts of the world, not only Ukraine, but Myanmar, Sudan, Afghanistan, Syria, Libya, Yemen, and there probably are more. There's the ravages that have been wreaked by the COVID pandemic on our health and our lives and on our economies and our livelihoods. And there's the undermining of democracy that has occurred even in the United States. But the desire for health is universal. Health is a tent under which we can all gather. If our role is to promote health, what must we do, individually and collectively? Many people, including public health professionals who consider this challenge, are frozen by seeing what they see as insurmountable obstacles. As New York State's health commissioner, I know that public health professionals, and you are now among them, have much to contribute. Please, be brave, take risks, trust your instincts, follow your heart, listen to the advice that makes sense, and toss the rest out. You are your best guide. The smartest people don't know everything, but they know to ask good questions. You, class of 2020, had to fight to be here through those Zoom lectures, deprived of classroom contact, not able to socialize much or go out on dates. Throughout the pandemic, you've seen public health soar in importance, and you've also, I think, been able to recognize the ways in which public health has been deeply undermined. So the class of 2022 is really a class unto itself. What better advice can I leave you with than to go forth and be the public health leaders you can be? We need you now more than ever. Thank you.
Commissioner Bassett, please accept this token of great appreciation, both for your service to New York State as well as your inspirational remarks today.
Thank you. I'm going to get my stuff in.
Please welcome the Vice Dean of the School of Global Public Health, Dr. Ana Abreu Lanza.
Thank you so much. It is now my great honor and privilege to introduce to you two phenomenal student speakers, both of whom are graduating today with their Masters in Public Health. Sarah Bond received her BFA in Musical Theater and BA in Arts Administration from the University of West Florida. She spent the next several years performing abroad and seeing food and health relationships in different cultures inspired her to pursue public health nutrition. At NYU, Sarah has participated in food media and policy research at the Feed Collaborative with Dr. Marie Bragg, and in breast cancer survivorship research with Dr. Vicki Ravis. She served as a co-president of Nutrition Without Borders, Apologia team lead, and member of the Global Action for Urban Health Lab. After completing internships at Food Tank, the think tank for Food and Kitchen Connection, a program of the United Nations, Sarah accepted a program manager role at the CDC Foundation. In the years ahead, she is committed to championing equitable, fulfilling, and sustainable food relationships for all. Our other speaker, Methany El-Tijani, received her bachelor's degree in sociology and nutrition from the University of Pennsylvania. During her graduate studies in public health, nutrition at NYU, she served as a teaching assistant and also joined the Socioeconomic Evaluation of Dietary Decisions, also known as the SEED Lab, utilizing research to inform food policy. She worked for the New York City Department of Health in the Bureau of Chronic Disease Prevention on a project examining the health impacts of the racial wealth gap. Methany is the recipient of the 2021 Ellen Solder Memorial Scholarship administered by NYU GPH. Methany is passionate about promoting racial and health equity and eliminating food insecurity and hunger. After graduation, she will be completing the Wisconsin Population Health Service Fellowship, a 2-year service and training program designed for early career individuals in public health. Please join me in a warm welcome to Sarah Bond and Methany El-Tijani.
Good afternoon, family, friends, and class of 2022. I'm Methany.
And I'm Sarah, and we are so proud to be here today with the next generation of public health leaders.
Now, I'm sure many of you can remember the feeling of excitement in getting your acceptance letter and discovering you'd be studying public health at one of the top programs in the country, and then slowly coming to the realization that you'll be taking your first graduate level course on Zoom from your childhood bedroom.
Methany is right. But this definitely beats Zoom because I know that I'm not on mute right now. After 2 years, I am still making that mistake. And after 2 years, it's still so humbling to look at the journey we've taken together in scholarship, service, and personal growth.
And although our time here may have been a bit different from what we envisioned, through it all, the spirit of this class never wavered. We forged connections, worked together, and encouraged each other to get the most out of this experience. And what an experience this has been. No one here could have predicted that we'd be studying public health in the midst of one of the biggest global public health crises in history. Throughout the pandemic, we've seen the public health sphere shift dramatically. We got a first row seat to see public health in action. We were here as we shifted to social distancing and remote learning. We were here as the vaccines were first developed and rolled out. And we watched as, for the first time ever, the CDC declared racism a public health issue.
We watched each other, too, as we cultivated the ability to collaborate, to listen louder than we speak, but to speak loudly and act boldly on matters of injustice and health inequity. Now, looking out on our peers, I see the resilience of a group that decided to step into unfamiliar territory during an unprecedented time and commit to their graduate education, even in the sometimes overwhelming waters of COVID-19. Those who knew it would be hard and did it anyway, because they believed in the necessity of their work and in our collective power.
The past couple of years have shown us why public health is and continues to be one of the most powerful fields. Achieving health equity across the country and across the world starts right here. As we prepare to join the field at such a critical time, we must consider how our efforts will move things forward. Now, this is the part of the speech where we get everyone feeling inspired with a really good quote. The late and great Toni Morrison told us, "When you get these jobs that you have been so brilliantly trained for, just remember that your real job is that if you are free, you need to free somebody else. If you have some power, then your job is to empower somebody else." As we become the latest addition to a group of world-class NYU GPH alumni, my hope is that we will use what we've learned here to pave a path for change, that we'll never forget what we're truly after, and that is a world where we all have what we need, whether it's opportunity or access, food or medicine, that we all have the ability to lead a healthy lifestyle.
As Methani said, when we leave here today, we join the ranks of NYU alumni. But when I look out on the faces of my peers today, I see more than just new graduates. I see people with the ability to turn statistics into stories. I see a community fully committed to the advancement of public health practice, both on a global scale and in our own Washington Square. I see a balance of grit and grace, both qualities that will make great public health professionals and that will make this group the most effective and innovative class to graduate from the School of Global Public Health. When I look out on this group, I am inspired by your potential and proud to stand alongside you. Seeing us here today fills me with something that has been less common in recent years: hope. Hope for the health and prosperity of our immediate communities, of future generations, and of those we will never know or see, but for whom we will work tirelessly to serve in the spirit of public health.
Before we go, we'd like to give a big thank you to all the people who helped us get here, to the faculty for sharing your wisdom and experience, to the GPH staff and administration for guiding us all the way through, and to our families and friends for their constant love and support.
You've all stuck with us through lots of exams, internships, and plenty of Times New Roman 12-point font double-spaced papers. And thank you, class of 2022, for your perseverance, your friendship, and belief that we can and must create a more equitable and healthy society for all. Here's the second inspirational quote. It comes from President John F. Kennedy's speech on our nation's efforts to go to the moon, but it came to me through my dad during one of many car rides home / motivational chats, and it really stuck with me. We choose to do these things not because they are easy, but because they are hard. Because that goal will serve to organize and measure the best of our skills and energies, And because that challenge is one we are willing to accept, one we are unwilling to postpone, and one which we intend to win. A change began the day this class enrolled as students, and it continues today as we leave as graduates, and we cannot wait to be part of it. From both of us,
Thank you.
And now we come to the portion of our program where we present our honors and awards. Please join me in welcoming to the stage the Vice Provost for Research at NYU and Chief Research Officer, Dr. Stacy Grossman Bloom.
Good afternoon. It is my honor as Vice Provost to be here with you today. Part of what I do at NYU is define and sustain emerging research areas and opportunities. And that is why it is my distinct privilege to open this section of your program, showcasing awards and honors. And at GPH, you have a lot to be proud of. GPH has more than 100 active research awards with an external value of more than $60 million from many, many different sponsors across the world. In the past year alone, your small but mighty faculty of 56 have submitted 129 proposals worth more than $160 million. Congratulations. To present student and faculty awards, I'd like to welcome my colleague, Dr. Melody Goodman, Associate Dean for Research and Associate Professor of Biostatistics, to announce our first award of the day, the Public Health Research Award. Dr. Goodman.
Thank you, Stacy. Good afternoon, everyone. As we begin the awards presentations, we'd like to start by thanking our founding dean for her remarkable contributions to forming and building our school. I'm going to go off script for a minute, but I just want to say that it takes a lot to turn a Global Institute of Public Health into a top 20 accredited school of public health in a few years, and she's done that. She's recruited a world-class faculty, all of you great students who are now graduates, and we as the faculty would just really like to thank her for what she's done for our school and for each of us individually. It's a reminder of our gratitude for your leadership and for your vision in our formative years. We would not be here without you. I would now like to present the Public Health Research Awards. These three remarkable students are given this award in recognitions of their excellence in research focused on improving the health of communities around the world. As I read your names, please join us at the podium. First, at the doctoral level, I'm thrilled to present this award to Gabriella Metzler, who has Gabriella has played an integral role in Robert Gernshorn and Alexis Mergenol's 5-year NIH-funded research project, New York City Transit Workers and COVID Impact of Multi-Level Interventions. She's a member of the inaugural cohort of Early Career Innovative Fellowships at the National Center for Atmospheric Research. Congratulations, Gabriella. Next, at our master's level, German Rivera Castiella. German has worked on research projects related to vulnerable populations, HIV, substance use disorder, stigma, healthcare access, and prevention services. He was also instrumental in handling a complex data management project that allowed his research team to submit an abstract for the AIDS 2020 conference. In his introductory epidemiology course in the fall of 2020, at the height of the pandemic, German's average in the class was the 5th highest out of 285 students. Congratulations, German. And finally, at the undergraduate level, Alessandro Malave. Alessandro conducted research as part of the NYU Urban Epidemiology Lab during his junior year in 2020. He worked with Dr. Danielle Ompad as well as other graduate and undergraduate members on a cross-sectional marijuana study, specifically assisting with drug packaging and contributing to the presentation of vaping and tobacco-related illnesses research. Congratulations, Alessandro. And I will accept this award on his behalf. I'd now like to welcome the recipients of our Public Health Social Justice Awards. First, I'd like to recognize our graduate students. I'll begin with Haley Ritsima. Haley has extensive experience in humanitarian settings through her work with Health Right International. She's been conducting implementation science research with Dr. P.T. Lee, focused on mental health outcomes in humanitarian settings. She was actively involved with Health Right as an intern with their Health Rights Clinic and a research assistant on a variety of projects. Haley is passionate about the health and human rights, especially as it relates to forcibly displaced persons. Congratulations, Haley. Next, Khadija Karma. Khadija aims to give vulnerable populations a platform in her advocacy by capitalizing on media outlets. This is exemplified in after-school YouTube channels she founded and manages. She's currently an NYU William N. Rahm Client Research Fellow studying the effects of extreme heat and cold conditions on pregnant Black women living in East Flatbush, Brooklyn, New York. Congratulations, Khadija. And last but not least, Emily DeGeorge, one of our phenomenal undergraduates. Emily has been volunteering with the New York City Free Clinic, which provides free and affordable health care to uninsured New Yorkers. As a member of the fundraising team, she has organized various fundraising and outreach programs to support the New York City Free Clinic. She further engages with New York City community by volunteering at the Lower East Side Girls Club, where she helps organize food pantry operations. Congratulations, Emily. Congratulations to all of our awardees. I would like to introduce the Director of Undergraduate Experiential Learning and Director of Public Health Practice, Dr. Karen Faber, who's a clinical professor of social and behavioral sciences.
Thank you so much, Melody. It is now my honor to recognize the recipient of the 2022 Public Health Practice and Leadership Awards. First, our graduate recipient, Sarabi Yadav. Sarabi has immersed herself in the GPH community as a co-founder and co-president of the EPIC Student Club, Student Club for Epidemiologists. In public health dentistry, she has assisted in numerous research projects involving oral health for HIV-positive patients, working on mental health research projects at both Columbia University and NYU. Through these efforts and her excellent academic record, she earned a scholarship to pursue her MPH degree. So congratulations, Sarabi. Here you are at the podium. Thank you. Congratulations. You're welcome. All right, next, our undergraduate awardee, Oishi Goswami. In the absence of a graduate president, Oishi was able to lead as the undergraduate president, coordinating the job of 2 people by herself and successfully planning for the school year throughout the summer. With her experience and guidance, the fall election was held and more people were elected to SGC. Oishi then helped to train and acclimate new members, showing great capability and leadership qualities. Congratulations, Oishi. Thank you so much. All right. I am now thrilled to present the Service to Community Award to 3 extraordinary students. First, our graduate students. We'll start with Jessica Alongi. Jessica serves as Director of Communications for the Healthcare Consulting Organization, which is a student club. She's also an onboarding ambassador for the Office of Student and Alumni Affairs, where she maintained communication with incoming first-year students of the MPH program. She wanted to make sure that the incoming students felt like a part of the NYU community before they even started attending any classes, and to alleviate some of the stresses that come with starting a graduate program. I'll do it. Thank you so much. All right. Next up, we have Jay Thompson. All right. Jay served the student body as a senator for the GPH Student Governing Council. He was an approachable student leader who went above and beyond as a member of the SGC. He collaborated closely with a wide range of community members, constantly and kindly working to achieve a rich experience for students. Congratulations, both Jessica and Jay. Jay, here you go. Congratulations. Okay, next up, our undergraduate awardees. We'll start with Angela Zai. As an ambassador in the GPH Undergraduate Ambassadors Program, Angela meets weekly with a small cohort of students and administrators to develop strategies to build community and increase engagement among students. Thank you, Angela. Thank you. And now we have Oishi Goswami. Oishi serves our GPH student body as the undergraduate president of the GPH Student Governing Council. Oishi served on the SGC for numerous years, including this year when, as the undergraduate president, she stepped up and represented the entire student body of GPH when the graduate co-president left the post. Oishi demonstrated impeccable professionalism, a laser focus, and determination to assure students were well supported during this critical time. She's quiet and understated, but brilliant in her leadership. So congratulations, both Angela and Oishi. Oishi, thank you. All right, and now it's my privilege to welcome Assistant Professor of Bioethics, Dr. Daniel Fogel. Thank you.
Thanks, Karen. So it's my honor to announce the winner of the 2022 Teaching Excellence Award chosen by the GPH faculty. So congratulations to our colleague, Jack Caravanos. So Jack has taught a variety of courses that are kind of perennially popular with graduate students and undergrads alike. He consistently receives high marks in course evaluations. In the classroom, he regularly elicits smiles and laughter, and that's something we could all use more of. From his students, does an excellent job being an effective teacher while also making learning memorable and fun. Students regularly note how much he truly cares about them as individuals and about their learning, how approachable he is both inside the classroom and outside the classroom. One nominator succinctly summed things up as follows: Jack is an excellent teacher who motivates and supports his students. Congratulations again, Jack. And now I'd like to welcome back to the podium Jay Thompson to present the Faculty of the Year Award, given to a faculty member chosen by GPH student body.
Perfect. Good afternoon, everyone. Cool. All right. Thanks, Dr. Fogel. So it's my honor to present the 2022 Faculty of the Year Award. This year's recipient is Dr. Jose Pagan, Chair. So, Chair of the Department of Public Health Policy and Management. This award is important for recognizing the impactful dedication of a faculty member, and it recognizes a role model who sets the standard for success of our community members. Dr. Pagan's classroom setting fosters trust and equity and aspires to encourage students to be socially conscious individuals. He has been a strong advocate for people of color, connecting students to resources, jobs, fellowships, and other resources to help advance students' career. Congratulations again, Dr. Pagan. All right, and our next speaker.
Now, a few words from special guests and some of our graduates.
Congratulations to you, the graduating class of NYU School of Global Public Health.
I want to congratulate all of you graduating from NYU School of Global Public Health. I'm sending you our very best wishes as you graduate and begin to make your invaluable contributions to improve our nation's health. Thank you.
Congratulations to you, to your families, and to your loved ones. Good luck, and God bless you.
I'm sure as you come here today, you're prepared, that you care enough, that you know enough, that you have the courage to do enough, and that you are determined to persevere until the job is done. We need you, and we thank you for having come this far.
The world needs your growing expertise, and all your hard work has led to this wonderful moment when you can roll up your sleeves and get to work as proud graduates of the NYU School of Global Public Health. Congratulations.
Congratulations as you graduate, and good luck to you on the road ahead. You know, in this pandemic we learned that the world needs you more than you ever imagined. So, thank you for being part of the solution.
So congratulations, New York University School of Global Public Health. We need you more than ever.
NYU meant growing as a professional.
That's the great thing about programs at NYU is that you can come here and you can take a chance.
It really meant the world to me. I really enjoyed my last 4 years here.
This opportunity shaped my life in ways that I never thought could be possible.
I genuinely loved each and every class that I took.
One of my GPH professors, which was Maribeth Griffin, qualitative methods with Professor Meltzer. She was the best, and that's where I met my SBS chicas.
Favorite professor was Jack Caravanos. I found a passion for environmental health because of him.
Favorite class was psychometrics with Professor Larry Yang.
All the professors have been phenomenal throughout my program, but my favorite professor has to be Dr. Daniel Ompod.
My favorite class was with Professor Buford with her urban policy class.
Dr. Goldman was also phenomenal.
I had the opportunity to conduct the fellowship as a Margaret E. Mahoney Fellow with the New York Academy of Medicine.
One of the internships I did do while I was at NYU was with the Broad Street Institute.
I'm also president of Mission for Mental Health.
I was so fortunate to have been a part of NYU's ISEE lab under Dr. Pepra.
I took on a research assistant position at the Lab for Developing Mind, as well as I did a recent internship with Pfizer over the summer.
I really want to combine my knowledge of biostatistics and my passion for mental health care in the United States together so that I can bridge that gap.
And as an Egyptian American, I would love to go back to Egypt and use my newfound knowledge, experiences, and skills and give back to the people of Egypt.
I'm originally from Bangladesh, so moved to Bangladesh, start some healthcare startups there.
For the rest of my life, I'm going to dedicate my life to reproductive justice.
I want to be an advocate for those
most minority populations, specifically my Latino communities.
I'm definitely not gonna miss all the technical issues we used to have trying to sign into class and record presentations.
One thing I won't miss is a commute. I do not like the commute. I don't live that close.
One thing that I'm definitely not gonna miss is working on my thesis.
Definitely gonna miss the life in the city, like everything's possible. It's a city full of dreams and opportunities.
I'm gonna miss the community that the Global Health program has given me. We're all coming together and we all have this passion for making the public healthier.
I'm definitely gonna miss this new building we have.
Bobst Library. That library is amazing. I recommend finding a spot and just sitting there for hours on end. It was wonderful.
Class of 2022, we finally made it.
Shout out to the graduating class of 2022.
So really take a moment to breathe and realize where you are and how lucky you are to be here.
Also, thanks to GPH because I met one of my best friends through this program. You guys are all amazing. I'm gonna miss all of you. And a big hi to my family, who I think are probably in the audience. Hi, guys.
Special thank you to my family, especially my mom. I couldn't have been able to do this without you guys. Thank you.
Shout out to my parents. None of this would have been possible without them. And my grandma, Kathleen.
Shout out some of my other friends, Jamie, Ariana, Diana, Sarah.
Shout out to my family, Mama Baba.
Hey Mom, hey Dad, hey Aunt Pam.
Shout out to my parents, to my friends, to my husband, and to all the supportive people I've come across through this journey.
Shout out to my nieces, Esther and Naomi. I'm working this hard for you so I can be a cool aunt.
Happy graduation!
And now, for the moment we've all been waiting for, the presentation of our graduates. For the safety of our graduates and faculty, we will be waving or tipping our caps instead of shaking hands. Now, to present our doctoral graduates, please welcome Associate Dean for Education and Professor of Epidemiology, Dr. Danielle Ompad.
Good afternoon. It is my honor to present the students receiving their Doctorate of Philosophy in Public Health. To assist with the hooding of our doctoral graduates, I welcome Vice Dean Abrado Lanza. Now, I'd like to invite our students and their mentors to the stage. Dr. Ariadna Capasso. Dr. Capasso's dissertation title is Violence Against Women and Problem Alcohol Use, an investigation of contributing and protective factors among Latinas and Black women in the U.S. informed by the theory of gender and power. I'd like to invite her advisors, Dr. Ralph DiClemente, Chair and Professor of the Department of Social and Behavioral Sciences, and Dr. Yesem Tozan, Assistant Professor of Global Health, to the stage. Congratulations, Dr. Capasso. Next, I'd like to ask Dr. Sarah Leaf to join us. Dr. Leaf's dissertation title is Racial Ethnic Disparities in the Impacts of ACA Insurance Coverage Expansions on Mental Health Treatment Among Adults with Mental Health Conditions. I'd like to invite her advisor, Dr. Diana Silver, Associate Professor of Public Health Policy and Management, to the stage. Congratulations, Dr. Leaf. I'd now like to invite Dr. Gabriela Meltzer to the stage. Dr. Meltzer's dissertation title is Children's Risk and Resilience Facing Cumulative Environmental Stress, a case study of the 2010 Deepwater Horizon oil spill. I'd like to invite her advisor, Dr. Alexis Merjanoff, Clinical Assistant Professor of Social and Behavioral Sciences, to the stage. Congratulations, Dr. Meltzer. I'd now like to invite Dr. Jamie Murky to the stage. Dr. Murky's dissertation title is Disparities in Cardiovascular Disease Outcomes, Examining the Role of Racial Discrimination, Telomere Length, and Allostatic Load. I'd like to invite his advisor, Dr. Emmanuel Pepra, Director of Implementation Science for Global Health and Assistant Professor of Global Health, to the stage. Congratulations, Dr. Murky. Last, but certainly not least, I'd like to invite Dr. Temetope Ojo to the stage. Dr. Ojo's dissertation title is Evaluating the Influence of Context on Feasibility as an Implementation Research Outcome in Low and Middle Income Countries. Hooding Dr. Ojo is her advisor, Emmanuel Pepra. Congratulations, Dr. Ojo, and congratulations to all.
Now, I'd like to introduce comedian, actress, and writer Molly Rubin Long, who will help present our students who have earned their master's in public health degrees. We begin with the students receiving their MPH in biostatistics. The chair and professor of the Department of Biostatistics, Dr. Rebecca Batensky, will help congratulate our students.
Yuhan Sun, Stephen Yan, Jenny Liang, Lan Fei Fu, Sandy Carrillo Agueta, Samia Shanawaz,
Now we present our students earning the Master of Public Health degree in Community Health Science and Practice. We welcome back Dr. Ralph DiClemente to help congratulate our students.
Esmeralda Huerta, Rachel Hurst, and then Khadija Kamara. Opeju Ayakoti, excuse me. Arian Abowi. Chloe Blaze. Kenneth Heron.
Now we present our students earning the Master of Public Health degree in Environmental Public Health Sciences. The Director of Global and Environmental Public Health and Clinical Associate Professor of Global Health, Dr. Chris Dickey, will help congratulate our students.
Amber Novato Mendez. Kate Potterfield. Rebecca Payne.
Now we present our students earning the Master of Public Health degree in Global Health.
Rosalba Gogaj. Yihuan Fang. Ridwana Islam. Lena Hani. Maliha Matthew. Alisa DiMaggio. Ashley Imuka. Mildred Korong. Carolyn Romano. Sierra Freeman. Yalen Engwang. Ade Tarior Faworle. Susan Shanti Priya. Archita Katika Neni. Fahad Farouque. Jayad Elena Smart. Amelia Violet Kimsey Aligahen. Reza Toralba Sison. Zihuan Chen. Assad Ghafour. Ariana Roland. Miha Lazarus. Giselle Gamaro. Paula Torres. Nivadita Ramajayam. Reina Bandari. Sahil Bangera. Puniti Shetty. Chelsea Gibson. Sarah Sutphin. Marianne Rojas. Nada Kelkawi. Caitlin Atawe. Farha Islam. Jasmine Lee. Ergia Iangar. Mintala Abbas. Hanan Yassin. Misty Tuboraha. Alma Chavez. Nadia Mona Krieger. Allison Marcin Koski. Eleni Irene Kokolakis. Saba Amjad Al-Sor. Melissa Griffith. Pinor Sadim. Shanice Eb Elhar. Indeep Janda. Ashlyn McCool. Dave Beichu. Alexandra Pastrana. Sharla Sarabia. Fatumta Sako. Siang Hoffner Walters. Sheridan Beard. Bethlehem Tesfaye. Muteba Adnan. Jaslyn Grays Molina. Eve Plotka. Ariel Rawson. Jamie Joellen Smith. Diana Striplet. Chelsea Chobani. Michelle Thorpe. Marwa Moeen Farden. Radhavan Nazare.
Now we present our students earning the Master of Public Health degree in epidemiology. The interim chair of the Department of Epidemiology and professor of Social and Behavioral Sciences, Dr. Raymond Niara, will help congratulate our students.
Courtney Comisian. Marissa Gerard. Stacia Octaviani. Haley Ritzma. Rulshway Dong. Surubi Yadav. Herman Riviera Costellar. Jordan Morales. Marley Reynoso. Marissa Soloso. Katrina Paleologos. It's close. Nasaira Hussein. Olivia Matala. Zilan Wang. Sarah Baker. Farhan Musin. Simone Cawthorn. Jewel Schofield. Rebecca Dang. Sonia Shaw. Nadim Atker. Alex Lee. Morgan Beard. Holly Romeo. Allison Graff. Esther Boschman. Pritiza Paromita. Slundi Colin Pierre. Sydney Haley Alexander. Junelle Bolis de Rondon. Lisa Mukherjee. Yan Wen. Mehnaz Hassan. Wilson Zhang. Xuanyu Wang. Xiao Ting Chu. Justin Tyler Lee.
Now we present our students earning the Master of Public Health degree in Public Health Nutrition.
Kiri Allen. Won Hun Lee. Okay. Ashley June Asamoah. Sarah Bond. Methani Eltijani. Sylvia Sabarin. Emily Hoey. Lishan Daronatsi Kiindu Nick. Gina Spigornadu. Jennifer Uritz. Wenxin Wang. Yining Leo. Wenqi Lu. Carolina Hernandez. Alexandra Kiska. Danielle Shapiro. Lindsay Tuck. Julia Rose Weiner. Aymara O'Brien Papalardo. Gabriella Pedno. Aaliyah Masterson.
Now we present our students earning the Master of Public Health degree in Public Health Policy and Management. The Chair and Professor of the Department of Public Health Policy and Management, Dr. Jose Pagan, will help congratulate our students.
Usman Naye. Raed Kadi. Jay Thompson. Jessica Alonji. Danielle Keene. Daniel Keene. Elizabeth Voigt. Elizabeth Furuya. Kaho Tenda. Alana Das. Mason Wolf. Hope Norris. Andi Lee. Ziwan Yan. Donning Luan. Jiang Xin Yu. Okay. Christine Hyun. Jessica Getz. Carolina Mata. Shalisha Smith. Nicola Alexia Canaris. Rifa Tasnim. Sherelle Kotler. Michael Adejokun. Roland Piradi. Caroline Egan. Anafor Rahman Chowdhury. Donika Joy Fernice. Alexia Polo. Sofia Palacios. Farhi Malik. Christina Figueroa. Leila Eldomyati. Nora Alamiri. Oluwafe Sayo Ogantona. Marissa Ryan. Janike Ronan Spencer. Anila Farouk. Esther Shawumi. Khadija Sise. Samrudi Kerdi. Ankita Mandiwe. Shivani Wategonkar. Matthew Batajlia. Michael Lipson. Madison Irving. Juhi Channani. Saba Hussein. Michaela Grant Thompson. Rahul Pandey. Michael Ivy. Sarah Afifi. Reshana Jagnanan. Shunel, that is his sister. Shunel Sito. Jared Hildreth. Hunter Sun. Miles Anthony Moore. Jaqueline Alicia Graham. Ali Hussein Swede. Layla Al-Niyadi. Tayyiba Wali. Natalie Lindor. Khadija Akhtar. Inadoya Yavo, thank you. Skylar Mackenzie Ford. Roberta Frossard. Yulin Osekufor. Faith Olasankanami.
Now, we present our students earning the Master of Public Health degree in Social and Behavioral Sciences. We welcome back Dr. Ralph DiClemente, to help congratulate our students.
Michelle Bendel. Erica Gonzalez. Gabriela Anrajo. Corinne Burke. Dakota Jones. Rachel Rothstein. Sarah Rose Hendrickson. Megan Winecoop. Ezra Solidum.
Now, we present our students earning the Master of Public Health degree in Sustainable Development Goals. We welcome back Dr. Chris Dickey to help congratulate our students.
Naomi Studman. Ana Sosa. Sierra Taylor. Leslie Hernandez. Sherelle Palmer. Elizabeth Glines.
Now we present our students earning the Master of Arts degree in Bioethics. The director of the Center for Bioethics and the Arthur Zittrain Professor of Bioethics, Dr. S. Matthew Liao, will help congratulate our students.
Olivia Pivovar. Shayna Moore Pierre. Yasmin Razak. Molly DeBlanc. Sophia Anastasia Ski. Iskandar Hakel. Mega Gauri Nayar. Liam Lieblin.
Now, we present our students earning the Master of Science degree in Biostatistics. We welcome back Dr. Rebecca Patensky to help congratulate our students.
Jing Shu. Olivia Danio. Delau. Jianan Zhu. Charlie White. Bushra Al-Rashidi. Lingzi Yi. Zichi Shi. Cece Cheng. Wenyang Chin. Jiashen Li. Rosemary Xian. Wanchu Chiao. Andrew Goldman. Sharder Islam. Yu Men. Zichi Liu. Yuthin Zhang. Ziwen Liu. Manuel Vasquez Sanchez. Hannah Asmail. Yongsin Zia. Wanting Sun. Yizan Liu. Jennifer Chung. Kira Chia. Qilin Wang. Zichao Xu. Andy Mai. Yaoji Wang. Pan Her. Zitao Zhang. Rong Wu. Fan Wu. I know no one's holding on.
Now we present our students who have successfully fulfilled the global public health components of the Bachelor of Arts or Bachelor of Science degrees in their disciplines. We welcome the Director of Undergraduate Programs and Clinical Associate Professor of Community Health Science and Practice, Dr. Joyce Moon Howard, to help congratulate our students.
Fatmata Berry. Nia Simone Harris. Tasfia Bashar. Iman Elnor Mustafa. Oishi Goswami. Angela Jai. Emily Natsuki DeGeorge. Tajmara Antoine. Morayo Olateru Olabeji. Kayla Miller. Varvara Ernst Rousseau. Kayla Boudram. Caroline Miller. Moreda Michael. Elisa Alvarez. Bianca Notrioni. Kajatu Bella Berry. Petrak Amankwa. Frida Hasselbring. Rhea Verma. Victor Liao. Spencer Lee. Cecilia Jane Reisner. Sydney Ellen Kisane. Catherine Siribriansky. Mia Danielle Lihavi. Peyton Delahaye. Francis Jacobson. Avni Varshney. Sophia Gabriela Moenzi. Giali Su. Merculis de Jesus Martinez. Brittany Omene. Nicole Giansanfi. Sophie Calliope Quigley. Leora Rafalilava. Brian Augusto Angulo. Shuin Lee. Ashani Pandita. Carlos Martinez Mejia. Isabella Alvarez. Mills Sandberg Reed. Gabrielle Stankosh. Hannah Stiental. Allison O. Sarah Perlutsky. Allison Kapostashi. Mira Aramugam. Jam Matthew Lucena de la Fuente. Ghislaine Jumonvi. Usma Bola. David Ramos. Sophie Abrams. Amanda Feingold. Sean Carr. Christina Brown. Rebecca Joost. Naja Aldridge.
Let us welcome back Dr. Cheryl Healton.
What a wonderful lineup of graduates. Let's give them one more round of applause. Woo! This ceremony is personally bittersweet for me, as it will be my last as your dean. After a decade here at NYU, helping to build and steer this fantastic new school with its extraordinary faculty and staff, I will soon hand over the reins to our terrific new dean designate, Dr. Deborah Furholden. Our new dean is an epidemiologist and public health professional with expertise in health disparities and health equity research, policy and practice, drug and alcohol dependence epidemiology, psychiatric epidemiology, and prevention science. Dr. Furholden joins us from Michigan State University, where she was the C.S. Mott Endowed Professor of Public Health, Associate Dean for Public Health Integration, and the Director of the NIH-funded Flint Center for Health Equity Solutions at MSU's College of Human Medicine. I have gotten to know Deborah Furholden, and she is a very, very special person. And this school is extraordinarily lucky and hands off to the terrific search committee led by Melody Goodman. I'd like to begin a new tradition today by asking her to join me so that I can pass the torch of the deanship to her. Dr. Furholden will then provide closing remarks as together we send you off to your continuing careers in public health.
Yes. Whew. watching you all walk on stage, I made the right choice. I graduated from Johns Hopkins, so my regalia should be this bright, offensive yellow. But I said, no, I want to be with them fully. And watching the undergrads and the master's students and the doctoral students, I literally saw myself in you all. So I want to leave you with 3 things. When I was an undergraduate, I had a full ride, but I never quite had enough money, right? Full ride didn't get me a plane ticket home to see my mom for Christmas. It didn't allow me to buy birthday gifts for friends, but I had a full ride. I had a really, really great advisor in graduate school. This man is brilliant. He's a living legend, but he didn't quite have enough time and attention for somebody who came to graduate school with so many pre-existing deficits because of the education that I got in grade school, high school, middle school. But I had a great advisor, and I had a really extraordinary family. My mom used to say I was the best thing since sliced bread and pockets, and you all know pockets are everything. But I didn't quite have the support because I didn't know how to explain to them that I was going through the hardest thing of my life. So I had this great family who really didn't know how to support me, and I didn't know how to ask. And so the thing that I got when I graduated, and I want to give it to you, and I ask you to just let it sink in, no matter where you came from, no matter what you've been through, you are okay. Yes. You all are worthy. You are worth everything. It was your birthright to have an extraordinary life and do extraordinary thing on the planet. And if anybody ever asks you why you think you're so special, you tell them Deborah Verholtme told me I was, and I believe her. And the last thing I will tell you is dream big. Don't let anybody crush your dreams, steal your joy, take your light. You are amazing. You are extraordinary. You are the possibility of everything. You take what you got here and you let it rip. We love you. We are all so tremendously proud of you. I'm honored to be joining you as your incoming dean. And thank you and congratulations, graduates, parents, loved ones, kids, partners, because we all did it. Everybody did it.